this video we're going to talk about bones of the skull. We're going to talk about the foramens where nerves and arteries and veins pass through. We'll talk about cerebral spinal fluid, ventricles, and meninges. Okay, so to start, we're going to talk about bones of the skull. We're going to have a couple of them. I drew the face so it's like facing this way, like a side view. Can't really draw in 3D. I have a 3D model here. Like you can see the front of the face. And then this is going to be the posterior view. Like, not posterior, but a view looking down, if you're looking straight down at it. So we'll go through the top first. So I have the back of the skull, right? This is going to be the occipital bone. It's going to be in the back of your skull. And the occipital bone is going to connect to two different bones. It's going to connect to the temporal and the parietal. So the temporal bone goes right around the ear. And the parietal bone is going to be kind of to the back of your head, like over here, but on top. That's going to be the parietal bone. So you're going to have occipital, way back, all the way in the back, temporal, and parietal. Okay, now, in the front region where my forehead is, you're going to have the frontal bone. So front for frontal, makes sense. Right underneath it, you're going to have the sphenoid bone. I kind of drew like a obtuse triangle, not too good, but this is going to be your sphenoid bone. And then right underneath that's going to be your mandible. This picture right here is not like an exact diagram. I just drew these structures so I could talk about like important points. There were important concepts that are important to understand. But let's continue. Mandible is right here at the jaw. Right above the mandible, I have the maxilla. So maxilla is going to be like the top, like where your mustache would be. That's going to be the maxilla. Right above that, you're going to have a nasal bone, which is going to be your nose. And then you're going to have a lacrimal region. The lacrimal region is going to be right where the eye is. So lacrimal, you could think tears, like a teardrop, where your eye is. Lacrimal, that's how the lacrimal bone is derived. That's where the name comes from. Okay, so a couple important things also to know about these bones. The main important thing to know is called the pterion. This is going to be the structure that's like, I think of a Bermuda Triangle, danger zone. A danger zone is 3 bones, right? The 3 main bones for the danger zone is going to be the sphenoid, the frontal, and the parietal bones. Bermuda Triangle, 3 bones, dangerous place, things go there, they never come back. So what does this mean? The pterion is a weak and it's easy to crack. So this is the point where these 3 bones, parietal, sphenoid, and frontal, meet. It's a thin, like fibrous layer that covers it. But what runs right underneath it is going to be the Meningeal Arteries. Okay, Meningeal Arteries. What are these things? These arteries go right to where the brain area is. So they go deep into the brain, and they also help with taking nutrients in and out of the meninges. What are the meninges? We're going to talk about them in 1 second. However, if you get a rupture, or if something happens to one of these arteries, you're going to get a hematoma, you're going to get a hemorrhage. You could like die from this. It's very dangerous. But we'll talk about it in a minute. Now, another important thing. I have linear written right here by the nose, right? A little above it. This is called a linear fracture. If you have a break right in this region of your skull, it's going to be called a linear break. Right above that, top region, where the frontal bone is, it's going to be called a depressed break. Above that, to the top of the skull, if you crack that, it's going to be called a comminuted break. And then right towards the occipital bone, if you get a crack there, it's going to be called a basilar break. Okay. Now, if you see I have my little Cowboys fan, because big time Cowboys fan, everything's going to be Cowboys. He's got a little Cowboys hat on. This is just a structure of like the front of someone's face. I couldn't really draw it much better. But right in this region, where the teeth are, on the bottom part of it, right here, this would be the mandible. So this is going to be the bottom of your jaw, right, the mandible. Right above it, the mustache region we talked about would be over here. We're going to call this, or this is what it is called, it's called the maxilla. So the maxilla is going to be right above that. And then right in this region, right, you got his nose. What's his nose? The nasal bone. One more bone we talked about in the front of the face that was important was in the eye, right? You have the lacrimal for tear. Okay. Now, important things I wanted to talk about. Not really these bones, because we already spoke about it over here. But I just wanted to make sure we knew it on the frontal side, the frontal view. An important thing I want to talk about is in this little eye capsule. So in the eye capsule, you have a lot of different things that run in and out of it. Okay. If you see over here, I blew it up into like 2 little boomerangs. I don't know, that's how I see it as, like a boomerang 1, boomerang 2, and then like a little like circle. So you have three main like foramens, they're called, in the eye, right? Foramen, or like is basically like a hole, a thing, an artery, a vein, a nerve that could run through, in and out. That's what a foramen is, so it's like a hole. Okay, so we have three different types. We have the superior orbital fissure. Okay, so what's a fissure? Same thing, it's like a foramen, it's like a hole, same thing. Inferior orbital fissure, same exact thing, it's like a hole area. And then we have the optic canal. What's a canal? Same thing as like a foramen or a fissure, a hole that things can run in and out of. Now, if I blow up, say the eye, right? I blow up one of the eyes, and you take out the eyeball, right? You take the eyeball out of the eye, you're going to see a hole like this, you're going to see a hole like this, and you're going to see another one like this. Well, this is going to be the optic canal, this is going to be the superior orbital fissure, and this is the inferior orbital fissure. It looks really weird, but this is going to be in the bones of the eye. And what are these things going to do? Well, they're going to bring arteries, veins, and nerves to supply your eyeball. So your eyeball, if you erase this, would be right above it, right? You have little eyelashes, I guess, little cornea, I don't know. But your eyeball was going to get supplied from all of these different things. What is in each one of these things? Let's talk about it. First, optic canal. First one I want to talk about, right? Smallest one, small guy. He's got the ophthalmic artery in it, so this is going to be the artery that's going to supply blood to the eye. And you're also going to have the V2 vein. What is the V2 vein? Not vein, I mean nerve. V2 cranial nerve. Okay, so I wrote 2, right? Cranial nerve 2. This is going to be one of the nerves that supplies the eye. So the optic canal is going to have cranial nerve 2 and the ophthalmic artery. Not too bad. Now, if we go to the first big boomerang, we have the superior ophthalmic fissure. Superior ophthalmic orbital fissure. What is this going to have? It's going to have a couple things in it. Superior for above. Orbital fissure is going to be in the orbital region. And it's a fissure, so it's going to have things running in and out of it. What's it going to have? It's going to have the superior ophthalmic vein. That's why I have them in blue up top, right? So what's that going to do? It's going to take blood away from the eye. And it's going to bring it where? Back towards the vena cava. That's what blood does. Arteries go away from the body, veins back towards the body. Arteries away from the heart, veins back to the heart. We also have 4 different nerves. We have 3, 4, 5, and 6. Now, before we talk about them, I want to talk about a little acronym to how I remember this. So 3, 4, 5, and 6, right? This is the main ones for the eyes. But if we write 3, 4, and 6, they make our eyes, right? 3, 4, and 6 make our eyes do tricks. I don't know, it's stupid, but it's how I remember it. 3, 4, and 6 make your eyes do tricks. So you know these 3, not veins, nerves. Nerves 3, 4, and 6, cranial nerve 3, 4, and 6 makes your eyes do tricks. Okay, so if 3, 4, and 6 makes your eyes do tricks, that means it's doing something to your eye. What about 5? How does that fit into the picture? We need to remember cranial nerve 5 is the trigeminal nerve. The trigeminal nerve has 3 different branches on it. V1, V2, and V3. But if we remember, V1 is ophthalmic. The trigeminal nerve branch, V1, so trigeminal for, good catch, trigeminal for 3 different branches, tri, and then knowing it's the 5th cranial nerve, CN, 5, so trigeminal nerve 5 stands for V. V1 is ophthalmic, so it's going to be ophthalmic innervation. So we know 3, 4, and 6, eyes do tricks, and cranial nerve 5, but V1 in particular is for the eye. So this is how we can remember the different nerves in the superior orbital fissure. Superior orbital fissure. Now, not too bad. Now what about the inferior orbital fissure? Well, there's a couple things we need to know about him too. One of them, it has the inferior ophthalmic vein. Makes sense. If the superior ophthalmic had a vein, the inferior ophthalmic is going to have a vein. Superior, inferior. Makes sense. It's going to have cranial nerve V2. A little bit different. However, if we think about it, it can make kind of sense. If you know inferior, right, is below, and superior is above, say up here, well, the one for superior is going to have 3, 4, 5, and 6, all for the eyes. But it's going to have V1, right? Cranial nerve 5, V1, is going to be for the eyes. However, if this has cranial nerve, like the inferior one has cranial nerve V2, Okay, V2 below. What is this going to innervate? Well, V2 is maxilla, so we're going to have a little bit below the eye, we're going to have by the mustache area. We're going to have the maxilla. So the inferior orbital fissure is going to innervate the cranial nerve V2. Trigeminal nerve 5, V2. Not bad. We're also going to have the inferior orbital vein. Okay, so we have ophthalmic and now we have an orbital vein. We have to remember that. And we're also going to have an inferior orbital artery. Okay, makes sense. If the superior orbital fissure has the superior ophthalmic vein and then the orbital canal has the ophthalmic artery, those two cancel each other out, right? They take care of each other. How are these going to take care of each other? Well, the inferior orbital vein needs an inferior orbital artery to get blood. So that's how they're going to take care of each other. They're going to balance each other out. That's basically all that we should really know for now with the eyes, like with the fissures and the optic canal. I'm going to talk about all the foramens now. Okay, so now, if we're looking at the bottom of the skull, right? Not the bottom, but like, if we're looking at the skull cut right across, right? And we're looking down into it. So we're looking into the skull. This is what we would see. This would be the top, not the top, but the anterior, ventral, same thing. This would be the posterior side, dorsal, right? The back. So you're going to have the front of the skull, like right here, would be this region. The back of my head is going to be right here, and we're looking down into the skull. So we're looking into it at that angle. Okay. Right here in the middle is going to be the sella turcica. This is a sella turcica. It's like a saddle-like cavity. What is this going to have in it? This is going to have the pituitary gland. The pituitary gland is going to fit right into the sella turcica. Okay, not too bad. Now, all these little structures I have around it, you see how I have them drawn twice? Why? Well, we know in our body, we're symmetrical. We have 2 eyes, 2 ears, 2 nostrils, right? So most of these foramens, these are all foramens. All these foramens are going to have nerves in them. These nerves have to go to both sides of the body because we're symmetrical. Okay, I don't know if I'm blocking the screen, so let me go over here. We'll start off with the first one, the carotid canal. Okay, the carotid canal, what do you think comes through it? Well, you have the internal carotid artery. Going right through the carotid canal, you have arteries. This is going to help supply blood to our face and our skull and our brain. So coming right through the pituitary gland, right near the pituitary gland, by the sella turcica, you have the internal carotid artery passing through the carotid canal. So carotid canal, like we said, it's like a hole. Something could pass in and out of it. Not bad. That's in blue. Now in green, we have the Foramen Rotundum. What is he going to do? Well, it's another foramen, so it's a hole, and he's going to have cranial nerve 5, but branch V2. What is this going to mean? Okay, he's going to, V2, we know he's trigeminal nerve. Second branch is going to the maxilla, mustache area. So this guy's just going to send the nerve right back to the maxilla. Okay, so the Foramen Rotundum, right, V2, we already spoke about him. Where did we speak about him? Okay, we said the inferior orbital fissure, cranial nerve V2, sends nerves to the maxilla, right? Same exact thing. So both of these guys help innervate the maxilla. Where in the maxilla? Well, the maxillary branch of cranial nerve 5, the trigeminal nerve. Now, next one, we're going to do him in purple, the foramen ovale. Okay, he kind of looks like an oval. I mean, that's how he looks like in a normal skull structure. I couldn't really draw it too well. But foramen ovale, he has trigeminal nerve 5, so cranial nerve 5, V3, so the third branch running through it. What does this mean? Well, what is V3? He's going to go to the mandible. So trigeminal nerve 5, or trigeminal nerve, branch 3, V3, is going to have mandibular nerve innervation. Okay. Next one, we're going to do him in pink, right? I have him on both sides because we're symmetrical. This is going to be the Foramen Spinosa. What's he going to have on him? Okay, so what's going to run through him? Very important. The pterion is going to be right there. What is the pterion going to do? Well, it's going to supply the arteries, the middle meningeal artery. We spoke about him up top. Remember we said the middle meningeal arteries is going to supply blood to the meninges? Well, if you have damage to this structure, we could have a hematoma. But I'm going to talk about it in a little bit. I'm just going to mention it's an epidural hematoma. That's all we should know for now. I'll get into more detail in a little bit. But the foramen spinosum carries that middle meningeal artery. Very important structure. Now, baby blue, we have the internal acoustic meatus. Okay, so that's foramen is going to carry what nerves? Well, we're going to have cranial nerve 7 and cranial nerve 8. What does this cranial nerve do? Well, it supplies nerve innervation to the ear. Next one, kind of like in sea green, we're going to have the jugular foramen. Okay, so it's going to carry a few things, the jugular foramen. See how it's noticed it's kind of big? It's going to carry the internal jugular vein, so the vein for the jugular. And we're also going to have cranial nerve 9, 10, and 11. So a good amount of things come from the jugular foramen. Now, in pink here, I have the hypoglossal canal. What do you think runs through him? Cranial nerve 12. What is cranial nerve 12? The hypoglossal. What is the hypoglossal used for? The hypoglossal supports all the muscles under the tongue. This nerve is for movement of the tongue muscles. Now, the last one I want to talk about is the foramen magnum, right here. What is he? He's the biggest structure, as you can see, the biggest foramen, which is something that runs in and out of. What does he carry? Well, he carries the spinal cord. He connects the spinal cord to the whole entire brain. Very, very important structure. So that's basically everything for the foramens. I'm going to talk about more of the meninges and like different areas of the scalp now. Okay, so now I'm going to talk about the calaveria. So what is this thing? All it is the skull cap. It's the top of the head, right? Your bone goes like this, right? Your skull, all it is the top. So the cap of the skull makes sense. What's important about it? Okay. In the parietal region, remember where the parietal was? It was like, you have occipital, you have frontal, and then you got like the parietal on the sides towards the top, right? So the parietal region has a lot of foramens in it. What type of foramens? Well, you're going to have foramens, which are holes, remember? And the foramens are going to have emissary veins in them. Okay, what are these veins going to have? These veins are going to go to the Doral Sinus, and this is going to also have the Meningeal Arteries. So it's going to have a lot of different foramens for a lot of different pathways which we're going to talk about. But what is this structure I drew here? Looks a little weird, I know. But this region right here, this whole black region, I have this as the scalp. Okay, so if you see the scalp here, and then you have this little arrow, I know it's hard to see in the video, but I'll point to it in a second. The scalp is going to be the top region. You have the skin, scalp, and you're going to have this whole region. What's this region? So this region right here is going to be your epidural space. It's going to have your Dura Mater in it, your Pia Mater in it, your arachnoid, right? You're going to have all the different type of meninges in them. What else? Okay, so through this space, remember I said there's a lot of foramens through the parietal bone in particular. You have the diploic vein, the Doral Sinus, which is this region right here, right? You have the emissary vein, and you're also going to have cerebral veins. What are these veins going to do? So these veins, if we remember the head and skull lecture or the lecture on the scalp that I made, you have the veins passing through the loose connective tissue. Okay, the loose connective tissue has these veins, and it's an important site for where infections occur. Okay, so if these veins pass through the scalp, right, through the bones, the different layers, they're going to drain into this area called the Doral Sinus. This is triangle shape I have. This Doral Sinus is then going to branch into different regions, different ways, and it's eventually going to end up into the internal jugular vein. We'll get there. Before, let's talk about the next picture I have. You see how I have this black box right here? It's called the fontanalis. What is this going to do? Okay, so you're a baby, you're developing, right? Your brain is growing much faster than your scalp. So your brain tissue is growing a lot faster than your bones. Usually lasts for about 4 years. Okay, why does this matter? Why is this even relevant? Okay, so you see these little lines, right? I have a green line, a red line, a blue line. These are sutures. So what are sutures? So the bones, right? The bones that we spoke about, the frontal bone, occipital bone, parietal, temporalis, right? They're all divided by sutures. So sutures are little like joints kind of that hold those bones together. Now, if your brain is developing faster than the bones are growing, what's going to occur? Your brain's going to like almost explode. So these little black things, right? Not black, but these little spaces, they're on all like the joint sutures, right? And it's called the fontanalis. What they do, it's like a fibrous, like a soft tissue that helps, they expand. It expands when the bones can't keep up. When the bones can't grow as fast as the brain, these things are going to expand with it. Okay, it's a soft spot. If you like touch it or something, you could feel for intracranial pressure on a baby like pressure builds up here if their brain is growing way too fast, or if there's a problem with their cerebral spinal fluid, etc. Okay, now, if there's a problem, it's called Cranial Cinatosis. Okay, what does this mean? So Cranial Cinatosis is basically the sutures are closing way too fast and these spaces don't have time to grow. Okay, 3 different types. So if we have scaphocephaly, this is the sagittal suture closing prematurely. What does this mean? So this suture, right, is fusing together way too quick. And now the frontal bones, the parietal bones on opposite sides, they're connecting and the brain is not able to, expand. So what's going to occur? You're going to have pressure building up to the other areas of the brain. Maybe this fontinalis, maybe the side ones, etc. And the brain could have deformities, and it could a lot of different brain functions could occur, like problems with development of the cerebellum, the occipital lobe, the frontal lobe, temporal lobe, etc. Now, that's scaphocephaly. Sagittal sutures fuse together too fast. Brachiocephaly, right? This is now if the coronal or lambdoidal sutures fuse together too fast. Okay, if these fuse together too fast, where's the pressure going to go? Well, it could go up here to the sagittal area, it could go to the sides. You don't really know, but just remember, the coronal and the lambdoidal sutures are when, brachycephaly is when the lambdoidal coronal sutures fuse together too fast. Last one, plagiocephaly. Same exact thing, coronal and lambdoidal sutures fusing too fast. However, it's only on one side, so it could only be on the left side. Or only on the right side, right? Either or, doesn't matter. So, brachiocephaly, coronal and lambdoidal, both sides. Plagiocephaly, coronal and lambdoidal, one side of the skull. Scaphocephaly, just the sagittal suture fused together too fast. So this is literally all I wanted to talk about the calaveria. And I'm going to talk about the meninges now in more detail. Okay, so now for the interesting stuff. The meninges. A lot of different things we could talk about, but I'm going to try to make it as simple as I can. So, in my drawing that I tried doing, I have skin, scalp, skull bone, right? Okay, let me slow down. There's an order, right? From superficial to deep. Different structures on the meninges, right? How we get to the meninges and what do they do? Well, we have to know the meninges cover the brain and the spinal cord, okay? They're going to be protected by multiple things because we need to protect them. Starts off with the skin, right? Skin of my head. Underneath my skin, I have my scalp, of course. The scalp has what? 5 layers, remember? 5 layers for the scalp. The mnemonic SCALP. Under that, you have the skull bone, which is my skull. Okay? Under the skull bone is when we start getting into it. First one we have is the epidural space. The epidural space, all it does is it splits the skull bone to the Dura Mater. Has some other functions, we're going to talk about it. Epidural space, then you have the Dura Mater. Now you see how I have a little triangle in the middle? So the Dura Mater, it consists of 2 different layers, which we're going to get to. But the Dura Mater consists of 2 different layers, and it separates. It's going to have a top layer, and it's going to have a bottom layer. In the middle of this separation, we're going to have something in the middle called the Doral Venous Sinus. This is what I was trying to speak about, or what I was saying before with my blue triangle. The Doral Venous Sinus, however, is the main thing where the blood is going to collect. What type of blood? If it's venous, deoxygenated. Okay? That's the Dura Mater. Under the Dura Mater, you have the Doral Venous Sinus, right? Then you have the Dura Mater, surrounding it. You go a little bit more posterior, not posterior, but outside a little more. We're going to have the Arachnoid Mater. Inside the Arachnoid Mater, or next to the Arachnoid Mater, lateral, you're going to have the Arachnoid Granulations, also the Subarachnoid Space. This purple region is going to be the Subarachnoid Space. Very, very important. Okay? Lateral to that is going to be the Pia Mater. Okay, before we dive into it, how I remember the 3 layers. Well, obviously everyone knows the mnemonic or the acronym DAP, Dura Mater, Arachnoid Mater, Pia Mater, but that's not doing anything for us. Dura Mater, D, Dura, durability. Durability means it's strong, right? This is going to be the strongest one, right? It's the toughest one. And what comes through it? Well, if we have something for the venous, right? We have venous blood here. Well, we're going to need arteries, right? We're going to need normal blood, oxygenated blood. So we're going to have the middle meningeal artery flowing into this region. Okay. Now, where does this region come from? Well, this region is coming from the mesoderm. If we remember embryology, this is the mesoderm. The Dura Mater is derived from the mesoderm. Now, that's D. Remember I said DAP, Dura Mater, arachnoid, Pia, not DAC as in Dak Prescott, but DAP, D-A-P. A is arachnoid matter. What is arachnoid matter? Okay, what is an arachnoid? Sounds like spiders, right? Arachnus, like the spider. Okay, and what is he going to do? He's going to be very thin, very delicate, fibrous membranes. See how I have these little X's? Well, these X's remind me of like a web, right? They form like a little web. And what are these going to do? They're going to connect this Dura Mater to the Pia Mater. And the subarachnoid space, of course, which we're going to talk about. But this spider web filament just kind of like reminds me of like it holds things together. That's how I remember it. I don't know. And that's, I remember spiders for arachnoid matter. Whatever. Last one, Pia Mater. Okay, Pia Mater. P for peas. Peas are very small. This Pia Mater is very, very thin. It is very thin, and what is it going to cover? This is going to cover the brain. It is literally going to hug your brain. Very important because it's hugging your actual brain. But it's very thin, that's why I remember P is for small. Okay, those are the three letters. Whatever. Like I said, in between arachnoid and Pia Mater, you have subarachnoid matter, with a subarachnoid space, right? What's in him? Cerebral spinal fluid. Whoa. Most important thing. Why do we need to know him? What does cerebral spinal fluid even do? Cerebral spinal fluid literally creates like a buoyancy for the spinal cord and your brain. You make about a half a Coke can of it a day, like a small amount of it a day, and it just takes off all the pressure off your brain and spinal cord. It contributes to the buoyancy. It helps 97 to 98% of buoyancy of your brain and spinal cord. So you're not crushing down on each other. You're like floating almost. Okay, where is that going to be stored? Right here, in between the arachnoid and in between the Pia Mater. How does this cerebral spinal fluid get to your brain and spinal cord then? We'll get there. Okay, now, what else did I want to talk about? I told you the epidural space, right? I said he has another important function. All right, well, you have the skull bone and the Dura Mater, epidural space in between. What does he have in him? Need something. Blood vessels? Okay, well, blood vessels need to supply this venous sinus, so it's somehow got to get to the Dura Mater. Fat? Well, fat is very protective of our body, right? It insulates things. And lymph? Well, we need lymph like our immune system. If you have a problem here, right, in this layer, what's going to occur? Well, you're going to have an epidural hematoma. We're going to talk about the hematomas in a second, but just remember, epidural hematoma comes from this space. Where else did we mention epidural hematomas? I'm sorry. I said in the foramen spinosum. The foramen spinosum has the middle meningeal artery flowing through it. If you have a disruption or like a block there, same thing, epidural hematoma. Now, one thing I want to also mention, if you're doing anesthesia, right, in somebody, and you're going to give them anesthesia, you're going to poke this area, this epidural space, but where? You're going to give them to the L1 vertebrae. Okay, just another thing to know. Now, I also mentioned this purple layer, right, is a subarachnoid space, and what did I say came from it? Cerebral spinal fluid. How does this cerebral spinal fluid go into our body? Okay. I'm going to talk about the mechanism in a second, but I just want to talk about one quick thing about it. This arachnoid granulation, right, is this area, this little thing cutting across the arachnoid matter, cutting across the Dura Mater, and flowing into the dural venous sinus, flowing into the triangle. If this granulation is fused with the dural venous sinus, what does this mean? Well, cerebral spinal fluid will like drip into that triangle. That triangle does what? It connects to the internal jugular vein, and then that vein goes where? Into our superior and inferior vena cavas, right? And when it goes into the vena cavas, what do? It goes into the right atrium, right ventricle, lungs, oh boy, oxygenated. Left atrium, left ventricle, aorta, rest of the body. So if the cerebral spinal fluid is in the bloodstream via the venous pathway, it's going to get pumped through our heart and pumped through the rest of our body in the circulatory system. I'm going to go over it a little more, but if you understand that, you know how it gets to our body. What are the hematomas? 4 important ones I wanted to talk about. Epidural, subdural, subarachnoid, and the high pressure. Okay, the first 3, you should be like, okay, we just spoke about this. I think I know what he's talking about. Epidural, where would he be? Well, he's going to be in the epidural space. Okay, if he's in the epidural space, he has blood flowing, right? Or blood accumulating. And he kind of looks like a biconcave disc. It's like a little sphere, right? And it's a straight line, they say. I don't know, I don't really see it. But I see the biconcave disc. And what is he going to do? So he's going to be the skull and the dural meninges, right? In between them. So here's the skull, here's the dural meninge. We know that. Epidural space is where it's going to take place. And it's going to lead to a clean line, like they said, and a lens shape. I don't see the clean line, I see a lens shape. Okay. What occurs from this type of hemorrhage? These are hemorrhages, right? Hematomas. It could be from a concussion, trauma, right? Hit to the head. You get a loss of consciousness. When that occurs, you could become very lucid, drowsy, and you could end up in a coma. Pretty dangerous. Now, that's epidural hematomas. Now, what about a subdural hematoma? Well, you should know where that's going to be too. Where is it going to be in between? Well, it's going to be in between the Dura Mater and the Arachnoid Mater. Subdural, underneath the dural. Make sense? So he's going to be in this region right here. It's really small, so I didn't really draw it in. I should have. But I'm going to draw it in black. Right there. In between the dura and then the arachnoid. It's going to be a subdural hematoma. What's going to happen with him? Well, it says it's going to have an uneven border since the arachnoid is thin and squishy. What does that mean? The arachnoid matter is what? Spiders, right? The web-like. It's very squishy. It holds things together. It could condense. It could stretch. So if the blood accumulates there, it's not going to be a biconcave disc. This would be biconcave because it's strong. It's connected to the skull bone. The blood can go wherever it wants. It's squishy. So it's going to be uneven, like I wrote. It's an uneven border. Makes sense. Subarachnoid. Where is this guy? Okay. We know we have an arachnoid matter. We have a Pia Mater. And what's in between him? The subarachnoid space. What's in the subarachnoid space? Cerebral spinal fluid. Very, very important hematoma. I have the blood diffuses into the subarachnoid space from the cerebral arteries. Okay, what does this mean? So if the blood fuses through the cerebral arteries into the subarachnoid space, what is going to be in there? Not just cerebral spinal fluid, but now we're going to have blood. This is going to build a lot and lots of pressure. What is this going to cause? This is going to cause the most severe headache of your life. Your head is going to be exploding. There is so much pressure. How does this occur? So if you have a rupture of an artery, you have an aneurysm, right? Of which artery? The one we just spoke about, the cerebral artery. You have head or neck trauma, like trauma to the head, boom. Pressure is going to build up because blood's going to flow into the cerebral spinal fluid area, known as the subarachnoid space. That's going to be known as a subarachnoid hematoma, or hemorrhage that I have. Same thing. You're also going to have a stiff neck, and you can have a loss of consciousness. Why would you have a stiff neck? Because it runs down your spinal column, so you're going to be stiff. You have so much pressure built up. Now, the last one I have written here, it's a high pressure hemorrhage, right? You have so much pressure built up from this subarachnoid one in particular. What's going to occur? Your pupils are going to explode. Your eyes are going to explode. You're going to have a blown disc, and you're going to have a burst of blood vessels in the retina. Your eyes are just going to be bloodshot. Their whole eyes. Your retina is bursted. So I know that was just a lot, but it makes sense if you go down in this process on how everything occurs. But the main takeaway right here is these hematomas. Main takeaway is these guys right here. I'm going to talk more now about how the cerebral spinal fluid enters our body, but just remember the subarachnoid hemorrhage and cerebrospinal fluid together causes the worst headache of your life. It is the most, I think it's the most dangerous one, or the most clinically important one for our test. Okay, so I want to continue about talking about the Dura Mater now. I got way too carried away and I got into the meninges and the hematomas. I should have done this together, but whatever. Here we are. So what do I want to mention that's so important about the Dura Mater? Remember I spoke about it goes into two different regions. Well, has two different paths, right? So you see how I have it like in different layers right here? Let me redraw it for you. You have one layer and then another layer, right? You have two lines. It's really fused together, but just think of it like this. Eventually, they're going to split. Why? Well, this is why. They're going to split into a top region and a bottom region. Top region, superior, is known as the perosteal, right, of the Dura Mater. The bottom is going to be the meningeal. Why meningeal? Well, it's going to be with the meninges. It's going to be next to the meninges. Now, when they split, triangle comes back, dorsal venous sinus. Okay. They split, right? They come back together. They split again. When they split again, they're known as the Doral septae. What's the Doral septae? Okay, he's like a seatbelt for the brain. It holds it in place, right? I don't have too much to talk about him. I mainly want to mention him, but just remember the Doral septa or Doral septae. He acts like a seatbelt. He restricts displacement of the brain, like he keeps it in place. Okay. The big thing I want to talk about is right here. The cerebral or the dorsal venous sinus. He's getting blood from where? Mainly from the cerebral veins. Mainly the cerebral veins. But it's the body. We have other things. Diploid veins and the emissary veins, right? Flow into this little triangle. Okay. Dorsal venous sinus. Why is he so important? Well, he's the storage of the brains from the skull. He's storing the blood. And then he's going to put it into the vena cavas out through the body, right? He lacks valves and a tunica media. Oh boy. What does that mean? Okay, most veins lack valves, right? So they can hold things in place where blood doesn't flow through. Well, not these guys. Blood goes to him. He's shooting them out. Doesn't have a tunica media. Doesn't really stretch or expand. He's just getting blood and he's just shooting it down. Where is he shooting it? Main one. Main one. Cavernous sinus. Very important. Why is he so important? Well, we can talk about him. Cavernous sinus does what? So in the middle of him, let's see, where do you think he's located? You know how I have him like a little Xbox controller, like a video game controller? I don't know, that's how I drew him. The center is the pituitary gland. Okay, where did we say the pituitary gland was located? Well, if we took off the skull, right, the head, and we look down into it, the sella turcica. Sella turcica is where the pituitary gland is going to sit. Didn't we have different foramens and different like layers that the nerves pass through? Canals, etc. Same exact thing. But now I'm just going to show you how the blood passes through him. Not bad. Okay, so in this cavernous sinus, we have a couple regions, right? We have cranial nerve 3, 4, V1, V2, so cranial nerve 5. Cranial nerve 6, so 3, 4, and 6 makes what? Your eyes do tricks. Okay. Where did we see this? Superior orbital fissure, right? 3, 4, and 6 makes your eyes do tricks. Similar. What else is going to be here? You're going to have the internal carotid artery. Okay, so before we talked about the internal carotid vein, now we can talk about the internal carotid arteries coming through the cavernous sinus. We need him. Dorsal venous blood passes through the cavernous sinus, drains into the internal jugular vein. Internal jugular vein, like we said, to the heart to the circulatory system. Why is he relevant? Still, why is this relevant? Well, okay, I have it on both sides, just our body's symmetrical, so you have 3 here, 3 here, 4, 4, 5, 5, 6, 6, etc., right? Whatever, symmetry. Pituitary gland, you have 1, so it's right in the middle. But that's besides the point. Why the hell is this dorsal venous sinus so important? This is how the cerebral spinal fluid is going to go to the rest of our body. It's going to go through circulation. Okay, how is he going to go through different circulation? And where is he going to go? Well, before we talk about that, let's just mention the different areas of the brain, or not the brain, but how the brain is divided, real quick. different folds, right? So this bottom region right here is the same as the top region. This is just a side cut. This is a cut where you're looking into it. Okay, see this blue region I have? It looks like a little like mohawk. So this blue region is coming right down the center of my brain, right down the middle, right down Broadway. What's he known as? The Falx Cerebri. He's going to have a superior sagittal sinus, and he's going to have an inferior sagittal sinus. Just top and below. He's coming right down Broadway. He's cutting the brain in half, the front part of the brain in half. Not bad. If he's the Falx Cerebri, we're going to have a Falx Cerebelli. What's he going to do? Well, he's just going to cut the brain in half on the back side. Not the back side, the posterior side. So you have the front side and the back, right? By the occipital lobes. That's what the Falx Cerebri is going to do. Cerebelli is going to do. Okay, one more region. You have the Tentorium Cerebelli. What's he going to do? He's going to separate the occipital lobe from the other lobes. He's coming across this way. Horizontally, right? Horizontal cross, right across. These two guys are vertical, right down the middle. This guy is horizontal, side to side. I don't know. I tried drawing in 3D. I couldn't. I don't know if this helps, but if you see, this is like a mohawk right across the middle. This green one is supposed to go across the side like this, and this orange one is supposed to go down the middle too, but it wasn't as planned. But just remember, the Falx Cerebri, front region, right? Frontal lobe splits in half, those two hemispheres. Falx Cerebelli, back lobe splits in half. Tentorium Cerebelli, horizontal, right? Try it. Okay, so now the moment we've all been waiting for, or at least I've been waiting for. How the dorsal venous sinus and the cerebral spinal fluid gets to the rest of the body. Finally, comes through ventricles. What the hell does that mean? Okay, so we have different ventricles in our brain, and different regions, and different spaces, and different ways blood flows. Okay, let's talk about the ventricles first. You have the lateral ventricle on either side, left side, right side, ventricles, right? They fuse together in the middle. They form the third ventricle. I'm talking the flowchart first because I like flowcharts better. So lateral ventricles, left, let's go left. No, this is my body. Right, left, right? Right side, left side. Okay, so this is the right lateral ventricle, this is the left lateral ventricle. Going to fuse together. Intraventricular Foramen of Monroe, it's called. It's going to be a little bridge, right? Thing that's going to fuse it together and it's going to take it somewhere else. Where's he going to take it to? It's going to take it to the third ventricle. Why third? Well, if the right lateral ventricle is number 1, or he could be number 2, same thing. Left lateral ventricle is number 2, or he could be 1, who cares? Well, that's going to be 3. So this is 1, this is 2, this is 3. Or 1, 2, 3, doesn't matter. Left or right, same shit. Same thing, sorry. Third ventricle then goes to the fourth ventricle. How? A little bridge again. Cerebral Aqueduct. Passes through the midbrain. The Cerebral Aqueduct is going to take this ventricle and connect it to the fourth ventricle. So you have 1, 2, 3, 4. Fourth ventricle, where's he going to go? Oh boy. He's going to travel through the Subarachnoid Space. Where was that? We're going to talk about him again, but we have to remember he's underneath the Arachnoid Mater and above the Pia Mater. He's in between both of them. Okay, Subarachnoid Space then goes to where? You know it. The venous sinus. That triangle, baby. Okay, let's just do a little picture real quick, explain it a little better. You have the corpus callosum, right? This is where the ventricles are going to be under. So you have the corpus callosum. You have the lateral ventricles, right? I have left or right, either or. This is the face looking this way, so we'll make them the left side. Here's the eyes and the nose. I tried. Okay, lateral ventricle. What's this region right here called? Intraventricular Foramen, right? This little bridge. Or Intraventricular Foramen of Monroe, whatever. He's going to go into the third ventricle. Cool. Third ventricle is going to go where? Well, the Cerebral Aqueduct. That little bridge, he's going to take him where? Fourth ventricle. Okay. What is important? What is important about these ventricles? Okay, so these ventricles, all of them, the choroid plexus is there. What does the choroid plexus do? He is going to produce the cerebral spinal fluid. No way. So all of our cerebral spinal fluid comes from these ventricles. These ventricles are going to put it into the blood, which we're talking about right now. So boom, cerebral spinal fluid. Boom, cerebral spinal fluid. CSF, right? Cool. Now, okay. What if there's something wrong with your cerebral spinal fluid and they need to stop it? Or like you don't want it in the body, they're doing something, I don't know, a clinical thing. Well, they're gonna put a block. Or if there is a block, you're gonna have damage to your body after the fourth ventricle. If there's a block here, you can't have cerebral spinal fluid in the body. Because these are the four ventricles. These four ventricles are just making the cerebral spinal fluid. That's it. Okay, let's continue. So this fourth ventricle, right? It came from the Cerebral Aqueduct, fourth ventricle. Travels down. Where is he traveling into? Well, if you see here, on the left side, right? I have a thing called a lateral aperture. It's called a Luschka. I don't know, maybe it's German or something. The lateral aperture is on the lateral side. And then you're going to have this medial region, right? It's this huge area, kind of, I don't know, it's like a ball, I don't know. He's known as the median aperture, and he's called the Meningeal. Meningeal, I don't know. Can't pronounce. But he's going to be this middle region. It's the median aperture. Not so important. What's important, though? Well, the cerebral spinal fluid keeps flowing. Where is he going to flow into now? Well, if you see this little purple line I have drawn, what is this purple line going to be? The arachnoid granulations. Holy crap. I'm going to redraw it real quick. Here's our triangle, right? What's this triangle called? Venous sinus. What was next to the venous sinus? Or what was around it? What was that region? Well, that was the Dura Mater, right? Engulfs the whole thing. Next to it was what? That little subdural space. But what was next to this subdural space? This region right here in black was our subarachnoid space underneath the arachnoid mater. So here was the arachnoid mater. Arachnoid mater. This is the Dura Mater. Right? This is the subarachnoid space where the CSF goes to. And then this is what? The Pia Mater. Okay, so this purple line, right, follows up through the body. Okay, where's he going? He's flowing up. He's flowing up, he's flowing up, he's flowing up. Oh boy, he's inserted into the calcavaria. Why would he go to the calcavaria? Or the calaveria, I'm sorry. What did we say the calaveria was? We said it was the skull cap, right? The top. Why is that important? What bone was very important about the skull cap? The parietal bone. What did we say was important about the parietal bone? It's got a lot of foramens in it. Why would he need these foramens? I don't know. Tell me. Here we go, right? This purple line is flowing up. What's this purple line containing? Cerebral spinal fluid. Where is this purple line? Where is this purple line? This purple, or what is the purple line? It's the arachnoid. It's the subarachnoid space, I'm sorry. So this is subarachnoid space, right? It's coming up. Say this line, right? I have it right here because I couldn't draw both. Well, he goes like this. He forms this little socket. What does this socket do? It's called a arachnoid granulation. This arachnoid granulation contains cerebral spinal fluid. That's coming from the purple, right? This purple line is flowing up through this subarachnoid, or through this arachnoid granulation. Going to the dorsal venous sinus. Now what? The blood rushes through the cavernous sinus, right? We have that cavernous sinus we talked about. Where does this cavernous sinus send the blood? That's a bad picture, I'm sorry. Sends it to the heart. Where's the heart going to send blood? Well, he's sending blood to the rest of the body. Cerebral spinal fluid is in our circulation now through this process. I know it was a lot, but like this was the best way I could explain it, and I don't know. I hope it helped. Okay, so let's do a little practice question. So following a traumatic injury, a 35-year-old man complains of loss of sensation in the skin below the eyelid. Okay. Let's draw the face real quick. Draw the eyes, right? Oh, really bad drawing. Little mouth, little nose, right? Okay, so he loss of sensation in the skin below the eyelid. Okay, so where's that going to be? Right there. And in the upper lip, okay, that should just automatically make us alert. And we say upper lip, we say mustache. What do we say about mustache? Maxilla. Okay, not a problem. X-ray reveals fracture of the base of the skull. Okay, not bad. We know base means what? Like basement kind of, bottom. So an involvement of the structure passing through which of the following skull foramina is likely to cause these symptoms? We got to know this. What the hell was the foramina? Well, the foramina was the holes that pass through the skull, right? Things travel through them. And where did we say? What is it? What did it ask? The base. So if that's the base, let me draw this a little better. That's the base. You have the Foramen Magnum, right? And then we have all the little foramens. Okay, but is it even important for us to... Yeah, it's cool that we could draw them out, like the sella turcica. We could draw out the ovale, the rotundum. Let me draw them in different colors. Rotundum, right? And then we could do the ovale down here. And then the optic canal. Well, the optic canal, that we already know this is wrong. Because this is... They said the base of the skull. So that's not... That's wrong. That's in the eye. Okay? And then let's see what else. The superior orbital fissure. Well, this is wrong. This is the orbit. The foramen ovale, maybe. We drew that out. Foramen spinosum. All right, we could draw those out real quick too. Where was he? He was like under the ovale, right? The small guys. Okay. Foramen rotundum, drew him out. And then the internal acoustic meatus, maybe, but it's saying it's going to the, where? Under the eye and the upper lip. Okay, so those could be crossed out. So now what did we say about the foramen ovale? What did he do? Well, he had V3, cranial nerve V3. What was foramen spinosum? The foramen spinosum was an artery, the meningeal artery. So you don't even write him. You know he's wrong because he's just an artery. And then what was the rotundum? Well, rotundum, I don't know. He's V2. Okay, so now we're like, okay, well, two options. V2 is, I'm pretty sure if you think about it, you remember this is the trigeminal nerve, right? Cranial nerve 5. And V3 is the trigeminal nerve, okay? Cranial nerve 5. And there was 3 different branches of it. 1, 2, 3. Well, the top one was the eyes, ophthalmic. The second one was, we already know the answer, maxilla. And the third one was mandible. And they asked us for a decreased sensation above the upper lip, which is the mandible, and under the eyelid. So we know this is the foramen for the question. Questions then. Let's see the answer choice. Yeah, A is correct. The foramen rotundum transmits the maxillary division, which we said, of trigeminal nerve. Boom. Okay, next question. A 6-year-old boy is brought to the emergency department with complaints of nausea, vomiting, and headache for the past 4 weeks. Okay. The headache is more severe when he wakes up in the morning. His head size is larger than normal, and an eye examination reveals papilledema, suggestive of increased intracranial pressure. CT scan reveals a tumor in the midbrain causing obstruction of the flow of the cerebral spinal fluid and dilatation of the lateral and the third ventricles. Which of the following is the most likely site of the obstruction? All right, so let's look through the questions then real quick. 6-year-old boy, we know. Emergency department, complaints of nausea, vomiting, and headache. Okay. Nausea, vomiting, and headache. Headache is more severe when he wakes up in the morning. Okay. His head size is larger than normal. Okay. Well, we could say this could be something to do with cranial cinatosis. Remember we talked about calaveria and the fontinalis? But I think I mentioned it's usually for 4 years and under. But let's not draw it out because the body's different. You never know. Okay, his head size is larger than normal and an eye examination reveals papilledema, suggestive of increased intracranial pressure. Okay, so there's an increase in pressure. A CT scan reveals a tumor in the midbrain causing obstruction of the flow of cerebral spinal fluid. So this is our most important thing, obstruction of CSF. Where? In the midbrain. Okay. So if we know midbrain and CSF, we should automatically know what the answer is. But say we didn't memorize it, and we just have to bring it from, like, what we know. Okay. And dilatation of both the lateral and the third ventricles. Okay, so we have to know what the lateral and third ventricles do. which of the following is the most likely site of the obstruction? All right, so if you don't even remember the picture, you just remember the flow chart I drew. We know we have ventricle, right? Lateral ventricle, lateral ventricle. I'm just shorting it. And you have a left and a right. And we know that they connected and they formed what? Well, they flew into the third ventricle. And the third ventricle flew into the fourth ventricle. Why am I not going down? Why am I not going into the subarachnoid space or the venous sinus? Well, because they said it was an obstruction to the flow of cerebral spinal fluid. So I think it's in one of the ventricles, because the ventricles are what create the cerebral spinal fluid. Okay, so now all these symptoms are clear that we know it's something to do with pressure or something in the head with the CSF. How can we determine where it's at? All right, so if we keep read the question one more time, we know it's in the midbrain, and we know it's something with CSF, and the dilation of both the lateral and the third ventricles. Okay, what the hell does this mean? That means it's right here. It's between this region. It's between the region connecting the third ventricle and the lateral ventricles. What region was that? Well, we have to remember, well, we don't have to remember, but if we remember, that middle region, right, passed through the midbrain. He was known as the Cerebral Aqueduct. So this tumor in the midbrain is is causing problems in the cerebral aqueduct. So this is going to be our answer. The interventricular foramen would be what? Well, he would be the problem over here. Third to the fourth ventricle. And they only told us about the lateral and the third. They didn't mention anything about the fourth ventricle. So he's wrong. What about the foramen of the Luschka? Well, he went from the fourth ventricle to where? He went from the fourth ventricle. I'm sorry, I have to draw it to the side. You have the lateral and the median. Remember the lateral and median apertures? And this one, the median one, was the Meningeal or Maginendy. So that would be answer choice A, which is wrong. And then the lateral one was the Luschka, which is answer choice C, which is wrong. Okay, so now why is the fourth ventricle wrong? Well, they didn't even mention the fourth ventricle in the stem. They just mentioned lateral to third. So all of these four answer choices, they're after the third ventricle. So if you just know that the cerebral aqueduct is before the third ventricle, you could get the answer correct. Okay, moving on. 2 more questions. You could skip this if you want. I don't know. I'm just going to rewatch my own videos and it helps me. Okay, following recovery from an infective... Okay, so the next 2 questions are on this little, like, vignette, whatever they call it. Following recovery from an infective pustule in the upper lip 2 weeks ago. Okay, upper lip, we know, boom. It should be what? Well, probably maxilla. So I'm just going to write maxilla up top because that's what I think of when I think of upper lip, mustache. A 20-year-old woman visits her physician with complaints of a fever, okay, severe pain in the eye and in the forehead, and double vision. Okay, so something's wrong with her eyes, her forehead, her vision. Okay. The examination reveals ophthalmaloplasia, paralysis of the extraocular muscles, marked edema of the eyelids, and exophthalmos. Okay. I don't even know what these are, but whatever. We know extraocular, something with the eye, probably. Eyelids, something with the eye. Okay. So this is something with the eye. Now, where is it going to be, though? Something with the maxilla is what they've mentioned. That's where the infection took place. So what are we going to do? What does the question even ask? Inflammation of which of the following Doral Sinuses is most likely responsible for the patient's symptoms? Okay, what were the Doral Sinuses? We spoke about them. Let's draw it out. We could draw out the face. And we spoke about the most important one, right? We spoke about the Cavernous Sinus. Okay, did we mention the other types of sinuses? Not really. I kind of skipped through it. I probably shouldn't have. But I'll talk about it right now. So, if you have something with the eyes, right? What do the eyes do? What are the cranial nerves in the eyes? Cranial nerves 3, 4, and 6. Well, 3, 4, 5, and 6, remember? But 3, 4, and 6 make your eyes do tricks. where was 3, 4, 5, and 6 located? We already know that little video game controller I drew. I don't know, that's how I'm remembering it. A video game controller had the sella tertia in the middle with the pituitary gland. And on the sides, it had 3, 4, V1, V2, and 6. On this side, same thing. Okay, and we knew this cavernous sinus has something to do with the eyes. So we could already assume that the answer is going to be cavernous sinus, because all it's asking us is that she has problems with her eyes. She has problems with her vision. And where? She has problems at the maxilla. So if you are confused that the cavernous sinus has something to do with the eyes, but for some reason you remember V2 is in the cavernous sinus, right? V2 was what? Maxilla. These are two different ways you could get the answer that the maxilla is the cavernous sinus that we're talking about. Upper lip, 2 weeks ago, eyes, boom, cavernous sinus. Now, last one. Through which of the following veins, okay, so they're talking about a vein, has the infection spread from the upper lip to the cranial cavity? Well, how are we going to break this down? Let's draw the little face, or let's draw a face, right? We drew the eyes. And let's just draw a mouth. He's a little sad, right? With a little nose. He's sad. He's upset. Okay. Well, the problem is in the maxilla, right? And probably somewhere in the eyes. Okay. What vein or what is in the eyes? If you remember from the video, we drew 2 boomerangs that come from the eyes, right? The superior orbital fissure and the inferior orbital fissure. And we also drew the carotid canal. Okay. Well, was there anything coming from the carotid canal? Well, it was cranial nerve 2, and we also had the ophthalmic artery. So if we have the artery and cranial nerve 2, is that saying anything with veins? No. Okay, so we're going to get rid of the optic canal. Now, what about the inferior and the superior? Okay, well, maybe. What does the superior orbital fissure have? Well, he contains the superior ophthalmic vein, if you remember. And what else does he contain? Well, he also contains the cranial nerves 3, 4, 5, 6. Make your eyes do tricks. Okay, and then what about the inferior ophthalmic orbital fissure? Well, he's going to contain the inferior ophthalmic vein. And he's also going to contain cranial nerve 2, the orbital artery, and he's also going to contain the orbital vein. Is this helping us at all with our question? Yeah, it actually is. Through which of the following veins has the infection spread from the upper lip to the cranial cavity? So it's coming from here, right? It's coming from the upper lip. And then he's going, right? The veins are connected. He's going where? He's going to the cranial cavity. So he's going up here. Where? Maybe the Doral Sinus, maybe, who knows. But he's going to this cranial cavity. How is he going to get to the cranial cavity? If we remember the way blood flows, we have to remember the superior ophthalmic vein and the inferior ophthalmic vein, right? They come out through the body, or they come out through the neck, and what do they process into? Well, they go into the internal jugular vein. This is the main vein that that the blood's going to flow through, right? Okay. But are we saying it's going out through the body? Is that where the infection's going? No. We said the infection's going to the cranial cavity. Okay. So what is above the cranial cavity? Well, here we go. Let's take it from the top. We have the maxilla, right? The veins from... let me draw it in blue. Let me keep it consistent. Erasing too much. Okay. Here's the mouth, right? And here's the veins from the maxilla, right? He's flowing up. What is he going to flow into? Well, he's going to flow into the superior ophthalmic vein, right? Right over here. He's not going to flow into the inferior one because the inferior one is going to be below. He's going to flow through the superior ophthalmic vein, and then he's going to go into the cranial cavity. So our answer's got to be the superior ophthalmic vein. Superior labial vein, cross him out. Retromandibular vein, not even in the things. External jugular vein or internal jugular vein makes sense if we're talking about blood flow back to the heart. But we're not. What are we talking about? We're talking about an infection from the upper lip to the cranial cavity. So we have to go reverse. We have to work backwards here. And this infection spreading through the superior ophthalmic vein. If they had inferior ophthalmic vein, that could be another way that you could be confused and you could be like, okay, this could be an answer. But those are way too similar choices because both of those veins connect. So you have to be like, boom, it's got to be the superior ophthalmic vein. It's the only one going more superior to the maxillary region. Well, I know this video is long and drawn out, but I hope it